Okay, so you did the prep, the numbers are on the board, the schedule is audited, and you walk into the morning huddle ready to go. And then you look around the room and everybody is just sitting there waiting for someone else to start. The office manager is gonna say a couple of things, someone else mentions that the patient is coming in 10, and then there's this awkward silence and no one quite knows what to do next. Does that sound familiar? Well, docs, that's not a motivation problem, that's not a team problem, that is a roles problem, and nobody in the room knows specifically what their job is inside of the morning huddle. And today, I'm gonna fix that. Every single person on your team needs to know their role. Welcome back to my Morning Huddle series. I'm Dr. Simone Ellis, and in episode 3, which is one I get asked the most requested about because people know the idea of a morning huddle, but they don't actually know the mechanics of what to say, this is that episode. Docs, if you're just jumping in here, I need you to go back and watch episode 1 and 2 because that's where we first discover what's the purpose and how to prep for a morning huddle. And it's definitely foundational for this episode. So the links are in the description. But for those who have already been following along, you have a purpose, you have a prep system. Now we are going to cover what every single role in your morning huddle is, exactly what each person reports, and the specific numbers each department owns, and the one role that surprises most doctors when I tell them what actually is their role in morning huddle. That last one I'm saving for the end, so let's get into it. Doctors, the reason why your teams go quiet in the morning is not because they don't care, it's because nobody ever told them what their job was in that room actually. And I wanna be really clear about this because this is something that when I see doctors getting really frustrated, I realize that the roles need to be reframed. And when people feel disengaged or silent or just like waiting for you to tell them to do it, it's not an issue of culture. It's definitely a role clarity problem. Because think about it, culture is the downstream of lack of structure. So if you get the right structure, the culture usually follows. And we see research in this, studies that have team-based in dentistry care, they consistently show that the practices with clearly defined roles and responsibilities are outperforming the ones without those roles and responsibilities on the clinical side and on the practice side. And almost all of those breakdowns, whether it's mistreatment opportunities, patient experience failures, are happening because nobody was explicitly told what they were responsible for communicating. So your morning huddle is the daily moment where the clarity exists or it doesn't. And now I'm here to talk to you about, as we walk through those roles, every role in the huddle has 3 specific things. They need to report what they deliver, the specific numbers that they own, and the specific strategies that they are responsible for bringing in the room. Not just information, an actual plan. Because that distinction between the information and the plan is what separates a huddle and creates momentum from one that just kills 15 minutes before the day starts. There are 7 roles in a full morning huddle, and for offices that are smaller, you just want to consolidate these down, but let's just use this as a standard. So if you have a pretty thriving practice, I would say maybe right at like 500 to a mil, you may have these roles, and these are the roles in morning huddle. Usually offices those sizes have an office manager, they have a scheduler, they have insurance coordinator, treatment coordinator, dental assistant, hygienist, and the doctor. So let's go through each one. The office manager's role is to open the huddle every single time. This is a non-negotiable, and I'm gonna tell you why in a minute, because when I see the doctor's role, this is the one that's gonna surprise you. The office manager's job in the morning huddle is to set up the financial context for the entire day. Not the month, not the whole year, just for today. And so exactly this is how it should sound. If I'm an office manager, I would start off with saying, okay team, our monthly production goal is $100,000. And as of today, we have 72,000 currently on the schedule with the remaining working days 12. And which means that for each of our working days, we need to close the gap with like $2,333. Today on the schedule, we are currently sitting at $5,400, which means that we are over our daily goal of $1,670 if everything holds. Did you see how I just did that? That's it, it's 2 minutes. So now your entire team knows exactly the financial picture without looking at how today fits into the whole entire year. Now, I wanna flag a couple of things. First, these numbers have to be accurate. So if your office manager is guessing or pulling these numbers off the top of their head, the team is gonna lose confidence and the huddle is going to dwindle super fast. fast. So that's why you got to go back and watch episode 2, because when the prep is done the night before, the report takes 90 seconds because the numbers are already sitting there. Second, the office manager should be tracking trends over time. So if we've been running behind production for like 3 consecutive weeks, that context belongs in Morning Huddle at some point. And we don't have to talk about it every day, but the team definitely needs to understand the urgency and where they are. So my first takeaway for you guys is have your office manager practice this 2-minute financial report before the next huddle. And the goal, the current, the scheduled production, the working days, the remaining targets, where the practice sits against the target, have them write it out and turn it into you a couple of times, or you can record it. Once that format is locked in, it'll become automatic. All right, so once the office manager does her spill and set the context, now the scheduler takes over. And I want to be very specific about what the scheduler is reporting, because this is where the role I see the most variance in offices. Like some schedulers are just reading off names on the schedule. And I'm like, what's the point of that? And some are giving procedure rundowns. Like, none of these are actually what we're here for, okay? That's not why we're here. The scheduler's job is to report 3 things. What is today's schedule by the daily amount? Like, what's the gap against the daily target? And what is the new patient count for the month? So it should sound something like this. Today we have 5,400 on the schedule. The doctor's side has 3,200, and the hygienist side has 2,200. So our daily target is 4,900. So we are 500 over today if everything holds. For this month, we've seen 18 new patients so far. Our goal is 30, which means that we need 12 more for the remaining working days. That is a scheduler who is operating like a revenue partner and not a calendar manager. Did you hear the difference? Now, this is where it gets interesting, because that's where most offices, they stop, right? And they start talking literally and going to the next part. But here's one of the things that they are missing the biggest opportunity on. After the scheduler delivers those numbers, she or he is going to give us 3 or 4 specific patients from today's schedule who she is going to personally ask for a referral or review. So not like general, but like by their name. So it'll look like Mrs. Thompson is coming in at 9:15. She refers people all the time. Mr. Garcia is at 11. He left us a 5-star review last time on Yelp. And this time I'm going to ask him to do it on Google. These are the people we are asking today. And then she names 2 or 3 specific strategies to close any gaps on the schedule. Not just the number with open slots, like an actual plan. Who is she calling from the recall list? Which missed calls from last 48 hours is she following up on? Whether did she reach out to a patient who called but did not schedule? I want you to pause here for a second and really sit with this. Your schedule has more influence over your production than any other person on the team. And it's not because of the appointment she books, but because of the revenue opportunity she either is actively pursuing or completely ignoring. The difference between a scheduler who is saying we have 2 open slots versus a scheduler that says, we have 2 open slots and here's my plan to fill them, is real money every month. Now, here's where most people, part of the huddle, gets kind of like dicey, and office managers either rush through this or we skip it entirely, which is a significant mistake, because this is where you found out if there's money that you can actually produce and make it into the bank account. And this is your insurance and billing coordinator. And depending upon how your office is set up, that may be 1 person or 2 separate roles, but they're responsible for the collection part. So because my office was such a large office, I had these as 2 separate roles. And what they did is they covered 3 things. Where are we at with our monthly collection goal? Where are we outstanding on all of our accounts receivable? And where is there any internal blockers that need to be resolved today to keep these claims moving? So it sounds a little like this. Our monthly collections goal is $95,000. We've collected $61,000 so far for the month. Our outstanding AR is approximately $34,000, with $18,000 of that being in current claims submitted over the last 30 days. And $16,000 of those are being worked in the last 30 days. I have 3 claims that were denied last week that I'm working on today, and I need to flag for all the assistants. The post-op x-rays on crown preps need to be submitted with every claim going forward. Did you see what I just did? That last piece is crucial, because when billing coordinators use the morning huddle to flag clinical document issues, What they're doing is that they're solving the collection problem before it becomes an aging AR problem. She is not calling out assistance. She is giving the team information which is going to help the whole office collect faster. Now, if your billing coordinator role, like my office, is separated from your insurance coordinator role, the billing coordinator then will specifically track the patient's balances and communication with the team about how to handle patients who have outstanding amounts coming in the day. And in my office, we had a standing rule, right? Nobody gets to the back without the outstanding balance conversation first. This is the morning huddle where we flag these patients at the front desk, which was prepped before the conversation didn't happen, and then now the patients are upset or pissed that they got to the back. And trust me, if you've had people get to the back and they have not paid for work, you are totally gonna wanna catch this really early on. Doctor, so takeaway 2 is that if your insurance and your billing coordinator is not reporting in morning huddle right now, that is a gap costing you real money in slow collections and unresolved claims. Add them to your agenda to start with your next huddle. The treatment coordinator is the bridge between what is on the schedule and what could be on the schedule. And so her job in the morning huddle is one of the most strategic ones in the entire office. So after the scheduler has went through her part and the billing and the insurance coordinator have went through their part, the treatment coordinator now has a clear picture of the gap, because they know exactly what needs to be produced today and what's currently on the schedule. And she now knows what is outstanding in collections. So that treatment coordinator's job is to come to the huddle with specific plan for closing that revenue gap and the patients that are already walking through the door. And this is the most piece that I think doctors don't consider, but it does change everything, because most offices, when they have a production gap, they immediately start thinking like, oh, well, we can just start calling people and get on the schedule. Who are you about to call the same day and get them on the schedule? Like, if you're busy and you have a job, chances are you can't take off. And it cracks me up because people will be like, yeah, well, we're gonna start calling our unscheduled, but like you're calling them the same day. More patients, more production, more volume. And I understand that instinct because it feels like action. But before you can start making calls, your treatment coordinator should be asking, what are we missing with the patients who are already coming in? Because the answer is almost always a lot. Patients come in with pending treatment that they haven't scheduled. They come in for hygiene when they also need to be on the doctor's side. They come in for a cleaning when there is a condition on a tooth that has been watched for the last 2 visits. And one of my favorite sayings is, I ain't watching nothing but a watch. Every one of these same-day treatment opportunities, that is your team either capturing or missing, and whether you capture it or misses it determines entirely on how well you prep for the appointment. So the treatment coordinator's job is in the morning is to flag those opportunities before the appointments even start. And if they are reviewing tomorrow's patients, she knows exactly what's pending treatment, and she can tell the assistants and the hygienists exactly what to do or to look for before the patients even walk in. So it sounds something like this. Ms. Chin is coming in at 10 for her hygiene appointment, but she has 2 fillings on her lower right side that have been pending since February. If doctor has any flexibility this afternoon and hygiene has a gap, I'd like to try to get that done today. I've also pulled her treatment plan, so we are ready to go if the opportunity is there. Also, Mr. Johnson is in at 2 for a crown prep, but his hygiene is 6 months overdue. I'm flagging him for the hygienist. In the case there's a cancellation, we'll go ahead and get this swung over to hygiene as well. Do y'all see that? Like, I get excited when I talk about it because this is where the treatment coordinator is operating as a revenue partner, and your team, when they hear that level of preparation in morning huddle, y'all, it elevates the energy in the room because everybody now understands that today is not about just getting through the schedule. It's about maximizing every single appointment. So most doctors think that the conversation stops when the scheduler has done and the financial reports have done. What they do not ask is what the clinical team is contributing to the revenue conversation in morning huddle. And let me start off with saying that in offices, I am not seeing this done well because I think that the contrast is instructive. In most offices, the dental assistants are only contributing to the morning huddle by a rundown of procedures and medical alerts. Ms. Smith has a latex allergy. Mr. Thompson has high blood pressure. Like, Y'all, does that really matter? I mean, it's not that it doesn't, but that's not gonna help us win the day. We are doing 2 crowns and 3 fillings today, and then they're here. I wanna be direct about this. Most information belongs in the chart, not in the huddle. If someone has a latex allergy, just tell your assistants to put the gloves out. We don't need to announce that in a meeting. What we need to be talking about is there any way for any of these patients pending treatment to get taken care of? Yeah, that is what's happening as a clinical team in the job. It's not let's recite the whole schedule. It is a strategic opportunity to flag things. And your dental assistants are reviewing their patients the night before as a part of the opportunity map prep that we talked about in episode 2. So they come into Morning Huddle knowing which patients have pending work adjacent to what's already scheduled, and the communication to the treatment coordinator so the treatment plan can already be available when the patient arrives. Y'all, that is, to me, chef's kiss. It is literally a team working together. And the hygienists, they're doing the same thing. They know which patients have what conditions and what the doctor needs to check for the day. And they know what patients have pending restorative work that they can flag to the treatment coordinator. So it is all over. The whole clinical team is operating this in Morning Huddle. The whole meeting, guys, transforms. You are not heading into this about procedure. You're not just hearing about things for the first time. You're hearing about opportunities. And with the clinical team working together with the front, it really does make sure the whole entire team is flagging things that really help us win the day. So your third takeaway is to give your assistants and hygienists one question to answer in the Morning Huddle every single day. Which of my patients today have an opportunity we have not captured yet? Because that one question answered consistently is going to add more production numbers than any marketing strategy that you can do. All right, so this one is going to surprise people the most. And if you stayed with me, this one is for you doctors, because I think that we need to really have a conversation. I have seen too many doctors trying to run morning huddles, and I think that you guys really do want the morning huddles to run well because you're the most invested. But in a well-run morning huddle, the doctor's role is entirely almost passive. I know, stay with me. Every other role in this meeting has a report to deliver, numbers to own, strategies to present. The doctor's job is to listen to all of it, ask 1 or 2 clarifying questions if needed, support the opportunities on the team that has flags, and close the morning huddle with energy. That is it. The doctor is not the facilitator. That is the office manager's job. The doctor is not running the scheduler. That is the scheduler's job. The doctor is not managing the collections conversation. That is the billing coordinator's lane. The doctor is the energy anchor. And I want you to understand how significant that job actually is before it sounds like it's the smallest job. In episode 1, I talk about it as well. People see the office as a place to go. So imagine Disney World. Disney World is what people come for, the energy, the whole energy. And I am Mickey Mouse as the doctor. When the doctor walks in the office, it is energy, it is engaged, it is genuine excitement about the team and what they've prepared. It is raising the entire frequency in the room. And when the doctor walks in distracted, late, depleted, it does not matter how good the prep was or how organized it was, the energy sets the tone for us not winning the day. So doctors, your job, show up as Mickey Mouse every single morning. Close the genuine huddle with genuine energy of let's do this, and be the one person who makes everyone in this room feel like the day is worth winning. That job is not small. It's literally one of the hardest ones, but you have to do it. So 7 roles, 7 specific jobs. Every person in that room has something to report, something to own, and a plan to bring with them. When every role in the office is operating in this way, your morning huddles are going to stop feeling like a meeting and start feeling like a team that actually knows what they're doing, because they actually do. If you're with me, episode 4, we're gonna go into the numbers layer, and I'm gonna talk to you exactly on how to calculate your production gaps, how to break it down from the doctor to the hygiene side, how to track your collections in real time, and how to use those numbers to have the kind of conversations and morning huddles actually move the needle. If numbers have always felt like someone else's job in your practice, episode 4 is going to change your relationship with them entirely. So subscribe, you don't want to miss it. And please, guys, drop in the comments which role morning huddle is currently your weakest link. Be honest. I read all the comments, and your answers are going to shape how we approach the conversation in episode 4. I'll see you there.